Okay, let's talk about the Graston technique here. We have several different options for tools as well as treatment techniques. So we're going to start with the GT1 here. It's a big handlebar-like device. So essentially with the Graston tools, what we want to do initially is you want to use the tool to scan the tissue to try to find your points of fibrosis, meaning areas of scar tissue, areas that might be kind of crunchy relative to areas that don't have any sort of restrictions to them. So the crunchy areas are essentially areas of scar tissue or areas of restrictions that need to be worked on. So we'll get in, we'll scan all the way down through and kind of work our tool all the way down in these sweeping like motions. Okay. Feeling for restrictions. Okay. From proximal to distal, from up to down, from down up, distal to proximal, same sort of thing. Okay, here, this is there. And so at the junction, very typical, the junction of the Achilles and the gastroc, you find a lot of restrictions through here. So with Graston technique, you want to get in, once you isolate your points of restriction, you want to maybe treat for 30 to 60 seconds per lesion. You can get in there, you can do some scoops. Okay. Work the whole area, Achilles, gastroc interface here. You can get in there and do some swivels, back and forth. Okay, all the way through. You can get in and do some fanning through here. Okay. And the more I'm on this edge of the device, the more I'm going to be grabbing. It's a little bit more aggressive versus being flatter this way. So, of course, the first couple of times you do this, we're not going to get too crazy. And the amount of, this should not be a painful, experience for our patients. I mean, it's going to be mildly sore as you're working the tissue. Okay, so we tell our patients, if I'm pushing too hard, let me know. Our intention is not to bruise through here. Some people get redder. They get more of this kind of a diffuse sort of redness is what we're looking for. We're not looking for a lot of blotchiness that occurs in here. If that happens, we're probably going a little bit too vigorous. Okay, so 30 or 60 seconds per lesion. We kind of work our way down through here, through the lower Achilles. When it gets into this area through here, for Achilles problems, for plantar fasciitis, we can actually grab GT4, and sometimes you can just kind of start them in there and just do some some sweeps back and forth along the hollow. Okay, all the way through here, switch, same sort of thing. I can scan first, I can sweep for treatment second. Okay, more sweeping motions through here. Okay, and then you can place them down, and then we can actually start to incorporate some more advanced motions as well. We start to use pin and glides. So, for example, we can go back to the calf over here, and Luke, let's just have you up and down with your ankle. Okay, just keep on going just like that. So I can grab that junction up in here, okay, and push through. Okay, and all the way down. It's a little slower, Luke. Okay, all the way up first, and then all the way down. Push. Good. And back up. So pin it and glide through. Okay, pin and glide. Okay. And also do a pin and stretch. We just kind of hold that little spot there. So come all the way up this way again, and then push down through, and all the way down through. Good. And back up. So this is definitely much more of an aggressive treatment. Grab that tissue a little bit more, a little bit better with the tool to get the stretch of the tissue. Okay. Same sort of thing with GT4 down on the Achilles. So same idea, up like that, and then back down, and then pin and slide all the way through. All the way down. Same idea, all the way down through. Okay. Same thing over here. Okay. Push. Good. Grab it and stretch it on through. Slide right through that tissue. All right. Then when it comes down to getting into the foot, you have several nerves that course down through the tarsal tunnel through here. The medial calcaneal nerve can get entrapped through here. The tibial nerve courses through here as well. So getting in, and same sort of idea, doing sweeps around the tarsal tunnel is always a good idea. You get in and work all that tissue through here. Okay, scanning, trying to find points of restriction. And we can certainly get in and do, pin and glides through here as well. Okay, as he's moving his foot back and forth, you can put it on stretch. And do your sweeps and your scoops in here. Okay. all the way down through. What I like to do also is take a belt, just have you bend your right knee loop, and stabilize the end of the leg. Hold that position there, and you can rest your right foot down, and then get in and work the plantar fascia. Here, GT5, you have many options. This will be a little bit less invasive because it's more of a concavity versus the GT4 is a convexity. It's going to get in a little bit deeper and a little bit, I guess more sharply against the convexity instead of the concavity. Okay, so same idea. You can get in here and you can scan, scan for lesions, medial fascia, central, lateral. You want to work the system all the way through that way. Same sort of idea all the way down this way. You okay, Luke? Making sure he's not going through too much pain here. I mean, like I said, it's a little bit of soreness is okay, but we're not trying to get them sweating on the table here. So, and then we can start doing pin and glide. So same idea, Luke, up and down here, then go a little bit slower, back up. Okay, you can go over, grab it and slide. Okay, pin it and glide. Okay, all the way through. And up a little slower. All the way up and all the way down. Good. So it's just a matter of trying to coordinate this with the patient. And then same thing coming back down this way. And then, okay, then push up against me. Good. Down this way. And back down. Good. Back down. All the way through. So your options are unlimited as far as what you can do for directions and motions. You could actually get in, and you could have done this up into the calf as well. You can start doing these little swirls, okay? But same thing, get in there, and you're trying to work things in 3 dimensions. Instead of just up and down, you can get in there and start doing, this swirling type of motion. If you find a point of restriction, it's not really, releasing like you'd want it to, you can get in deeper and do this as well. Okay, all the way through. And that's pretty much it. So it's a very, comprehensive approach to treating, Achilles pain, plantar fasciitis. You want to treat the calf, the Achilles, the hollow, tarsal tunnel, foot all the way down through, all the way down to the first ray, and that's good. Thanks.